Medical News from BMJ, Clinical Research Edition. Low concentration atropine eye drops and progression of myopia in children, multicentre placebo-controlled, double-masked, randomized trial in the UK, CHAMP UK. The use of low concentration atropine eye drops has been found to significantly reduce the progression of myopia in children, with a mean difference of 0.33 dioptres compared to placebo, which is a crucial discovery given the rising prevalence of myopia worldwide and its potential to cause severe visual impairment. This matters because myopia is a leading cause of visual impairment in children and can lead to severe ocular complications later in life, such as retinal detachment and glaucoma. The findings of this study are particularly important as they provide a potential treatment option for children with myopia, which can help prevent the progression of the disease and reduce the risk of associated complications. Myopia is a significant public health concern, affecting millions of children worldwide, and its prevalence is increasing rapidly due to factors such as decreased outdoor activity and increased near work. Despite its high prevalence, there is a lack of effective treatments for myopia, and current options are often limited to corrective measures such as glasses or contact lenses. Previous studies have suggested that atropine eye drops may be effective in reducing the progression of myopia, but these studies have been limited by small sample sizes and variable concentrations of atropine. This study was needed to provide high-quality evidence on the efficacy and safety of low-concentration atropine eye drops in children with myopia. The study was a multicentre, double-masked, placebo-controlled, randomized trial conducted in 5 UK centres, involving 289 children aged 6 to 12 years with myopia between -0.50 and -10.0 dioptres. Participants were allocated to either the atropine group or the placebo group in a ratio of 2:1 and received one eye drop of preserved atropine 0.01% or placebo daily for 2 years. The primary outcome was the spherical equivalent refractive error of both eyes measured by autorefractor under cycloplegia after 2 years, while secondary outcomes included change in axial length, best corrected distance and near visual acuity, reading speed, pupil diameter, spectacle correction, adverse event rates, quality of life, and tolerability. The study used an electronic monitoring system to assess adherence, and outcomes were collected every 6 months. The results of the study showed that atropine eye drops were more effective than placebo in reducing myopia progression, with a mean difference of 0.33 dioptres and a 95% confidence interval of 0.17 to 0.49 dioptres. The study also found that changes in central axial length were significantly less in the atropine group compared to the placebo group, with a mean difference of 0.14 mm and a 95% confidence interval of 0.07 to 0.21 mm. Pre-specified subgroup analyses did not show any differences in the efficacy of atropine according to age, ethnicity, sex, or severity of myopia. The study found no differences in other secondary outcomes, except for pupil diameter, which was greater in the atropine group, and no differences in the frequency of adverse events or intolerability measures. The findings of this study have significant clinical implications, as they suggest that low-concentration atropine eye drops can be used as a treatment option for children with myopia. This could lead to changes in clinical practice guidelines, with atropine eye drops being recommended as a first-line treatment for myopia in children. The study's results also highlight the importance of early intervention in the treatment of myopia, as the progression of the disease can be slowed or halted with effective treatment. However, the study's findings should be interpreted with caution, as the study had some limitations, including a relatively short follow-up period and a lack of data on the long-term effects of atropine eye drops. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.